So if you are looking for and inquiring about insurance, this is what today is all about. We are back to our adulting series where, we're the adults now. We got to make these decisions, much to our dismay. So joining me today, I'll let you guys introduce yourselves. But I'm so grateful for your time and your expertise, and personally for helping me walk through getting my family covered for the 2026 year to come.
Yeah, as always, thanks for having us, Kerry. We're happy to be here. My name is Miranda Potts. I am an internal sales agent here at Priority Health. I've been here for 9 years so far. And again, like Kerry said, just wrapping up this last week or so of open enrollment.
Name is Omira Mejias. I've been with Priority Health now 9 years. And same as Miranda, just ready to get open enrollment wrapped up.
I feel you. I totally, I can only imagine because it starts, we talked about this in October because it starts, in October? Is it November?
November.
November 1st.
November. We just start talking about it in October because November. And then again, it's stretched out for those of us that wait until January. So I apologize in advance for my own stall, but we got through the holidays and now it's time to focus on this. So can you tell us a little bit about Priority Health?
Absolutely. We are a nonprofit health plan recognized nationally for quality and service. Our headquarters is right here in West Michigan. We have our hearts and our roots right here in the Mitten State. That means that when you see Priority Health at events like the Little Guide stroller roll, for example, that we did this summer,
Yeah.
handing out diapers, you're not just seeing us giving back to Michigan communities. You're watching us help our communities, our friends, and our neighbors as well.
Yeah, and being Michigan-based also allows us to offer help where it's needed the most, like opening up fitness centers, or fitness courts and parks in high traffic areas, so that Michiganders in Lincoln Park, Belle Isle, Hamtramck, I hope I'm saying that right, and many other neighborhoods throughout Detroit can find more time, space, and budget for physical fitness. It does also mean that the hospitals in our network are well known in Michigan institutions like Beaumont Health, Trinity Health, Henry Ford, U of M, and many others, and that we can offer plans from employer sponsored to individuals that Michiganders actually need.
Yeah, it's one of my favorite things is that you guys are actually locally based and so that I can reach you on my time zone, on my timeline,
Mhm.
and obviously we partner with you guys and love our partnership, not only with stroller rolls, but then we see you out and about in the community all over. And it really, to me, it just solidifies my decision to um, support you guys because I know you guys are supporting myself, my family, and our community. And that, again, through all that you guys mentioned, it's
Mhm.
Hamtramck, by the way. Well, we got you
Hamtramck, thank
covered.
you.
Um, but that people see you out and see what you have created and sponsored and that you're truly in the community with us. So that means something. It means a lot to me personally. So but let's start getting into the insurance and how you cut it down. You talked about employers. For those of us who are self-employed, myself included, my husband included, we have to have individual health plans. Can you talk a little bit about what is an individual health plan?
Yeah, sometimes people refer to individual health plans as private insurance. And like you stated, you're becoming a professional now, Carrie. It's coverage for anyone under the age of 65 who can't get a health plan from an employer or Medicaid or Medicare. So, again, for people who are self-employed, freelance, their company doesn't offer health coverage. Individual health plan is the way to ensure that you and your family have medical coverage. It's also a plan to look into if you are out of work, possibly retiring early. It can help families just get that coverage in between that little time too.
When you're shopping, I mean, it's so overwhelming doing this, but what are some of the key components or what should these families be looking for when they're shopping for an individual plan?
Yeah, that's a great question. So there's a ton of options out there, and finding the right plan can be daunting. Your family's health isn't something you want to leave at chance. There are a few things you want to keep in mind and a few to watch out for when you're looking. A lot comes down to looking at the total cost of the plan. Premiums are the amount you pay each month for the plan itself, and it is tempting to pick a plan with the lowest premium, but that is only one part of the picture. You don't want to save money on a plan for those savings to evaporate with a big deductible. But since the deductible is the amount you have to spend before the plan starts paying for some services, visits, and a high deductible can mean that you're spending quite a bit more money before your coverage actually contributes to that.
Yeah.
Yeah. And we can talk a little bit about those copays. People sometimes don't know the difference between copays, deductibles. Um, a copay, it's a flat fee that you pay at the time of service. It's due each time that you visit the doctor's office. You know, you're paying it right there when you're checking in most cases, or when you're picking up your prescription from the pharmacy. If you are an individual who is managing a chronic condition, you're likely paying multiple co-payments in a month or in a quarter because you're having a lot of follow-up appointments. That's where, in that case that Elmira was talking about, to save some money on the silver tiered plans, you could save money with lower co-payments, and silver tiered plans offer more services covered ahead of deductible. And going back to, Priority Health being a Michigan-based company, um, it's nice to work with agents who are within Michigan because you can ask us questions like making sure your doctor is in network because out-of-network costs can be pretty expensive. Each plan that we offer has a network made up of providers and facilities that do partner with them to provide care for a lower price. So when you visit a doctor or a hospital that's outside of the network, you end up paying a higher cost. So it's really important to make sure that your doctors, providers, places of service you're going to are in network with the plan. Same with medications. Each plan or carrier has a list of covered drugs. It is called a drug formulary. It does show what medications are covered and what you will pay for them based on its tier. If you have a child that has a chronic condition that requires medication, like say an inhaler for asthma, for example, you'll want to make sure that those types of prescriptions will be covered on the plan that you choose when you are shopping for coverage.
Yeah.
Right. And then you can also make sure your care is covered by checking your plan documents or by calling doctors and specialists or even us to be sure that they are in network. Priority Health does make it easy for our members to check online too with our Find a Doctor tool. What I really do like about that too is that once you become a member, that Find a Doctor tool is going to be tailored to your plan. So if you do choose an out of network, or excuse me, if you do choose one of our narrow network plans, it will be tailored to those doctors only. So it takes away, the guessing game. You can search your doctors by name or you can search by area to find the in-network providers near you. So it really does, it's a really great tool for our members to use.
Yeah. And I have personally done that where Miranda, you and I sat on when I first many years ago transferred over, we looked at all of our doctors. You know, I love our pediatrician and I wanted to make sure and you help walk through that of like, okay, your doctor, your OB is, but your general practitioner is not. So we found a new one that was, and she's great. I love her. Actually, more than the last one. So, um, but it was important because, I didn't my kids were used to going to the pediatrician that they were going to, so it's there are things that you're like, okay, I'm okay and I like my OB. So there are things I want to make sure come over, and there are other things where I'm like, yep, let's find a new one. That's okay. But I think a lot of parents would say that too, where it's like, yeah, and just knowing going in where you're not surprised. Um, so that's one of the benefits of calling you guys and having you walk through it. And now I'm a little bit more proficient where I can check on the site myself to look at doctors. So love that. Miranda, you had mentioned chronic health and chronic conditions with, family members, kids. What if you don't have any chronic conditions? What if you are, a healthy bill for your family? knock on wood. How,
Well, the
what does
absolute
that
picture
look
of
like for
health.
you?
Yeah.
Yeah, that's what we're looking for, right?
Yes. Yeah. So even if your family is, like we said, the picture of health, right? It's still essential to have coverage. You can check your eligibility for subsidies or explore options to find a plan that is less expensive. But going without coverage is just entirely, it's a major risk that you're taking. Skipping coverage even for a year may seem like an easy way to save money. But as some of us know, we stop paying a bill and we don't do the smart thing and put that money away for the emergency that we stopped paying for something for. So, it may seem convenient at the time, but it can cost you big in the long run. And no parent wants to think of their child being hurt, rushing to the emergency room. And the reality is that, kids are not made of steel, so that will happen. And no one is completely immune to illness or injury either. Um, and so I guess the last thing you want to do is come home with your get well soon balloons and be worrying about these bills that are coming. It's a major risk you're taking without going without coverage.
Yeah.
One other thing too, without a health plan's contribution, those financial burdens can be extremely high. One day in the hospital can be upwards of $10,000 without health coverage. And again, that's just one day. Could be, half of a day, a few hours. Just depends on what you're there for. Think of an appendicitis. It usually comes on suddenly, and surgery is scheduled within days or right when you get there. For like my sister, for example, if not hours, like I said, due to the kind of treating that is needed. But even as a fairly routine inpatient procedure, a few days in the hospital for an appendectomy, I believe they're called, can cost between 20 to $40,000 without insurance.
Yeah, and even with the healthiest child, they can fall from a slide or catch the nastiest winter bug. And this year, it took almost my whole family out. It was really bad.
Oh,
And with the regular checkups and preventative cares that my priority individual plan covers, many of those contagious illness don't make as big as an impact in the first place. Keeping your child's vaccine schedules, it helps them fight off those illnesses like measles and the flu. That can have a big effect on little bodies. Preventative care isn't just limited to vaccines, though. Even with a well child visit, where those vaccines are given also to monitor your child's milestones and developments to ensure that they are on the right track and to get them to a specialist if not. And preventative care is also it also includes screenings for conditions like diabetes, where early interventions can make a huge difference along with support for new moms, including breastfeeding support and counseling. Now, enrolling in a health plan, it gives you that peace of mind knowing that you're doing all that you can to maintain your family's well-being and knowing that you're covered if an emergency happens.
well, now the $1 million question is what is the timeline? I know we have alluded to it before of we're coming up on the timeline, but can a family enroll at any time? Or is this, is the deadline the deadline?
Yeah, so we'll talk some dates. So get a pen and paper out. In most cases, yes, you have to sign up for your plan during open enrollment. Open enrollment, it's the period where anyone can shop for coverage, and that happens November 1st through January 15th this year. So you still do have some time. What do we got into next week? I think is the 15th.
Mhm.
My dates have gone lost on me now, but again, hurry because January 15th, it is coming up really soon, and it's the last chance to sign up for coverage to start February 1st for this open enrollment period. And I'll let Elmira kind of go over special enrollment periods.
hmm So there are exceptions that can let you get a plan outside of open enrollment called a qualifying life event. These things, like birth of a child, losing Medicaid eligibility, changing jobs, getting divorced, it creates a special enrollment period that allows you to enroll outside of open enrollment. So it is important, to consider a health plan in those circumstances when they change. But you don't want to leave it to chance. In most cases, open enrollment will be your only opportunity to enroll in a plan for the coming year if you don't have any of those qualifying life event changes.
Yeah. It's always good to remember that if you are, especially with our demographic, if you are planning to have a child or
Mhm.
adopt, that certainly qualifies as a life-changing event. But you need it in you need to have it in order, to have the child go. I've seen the bills of each of
Mhm.
my children. They cost me a lot of money, and even with the insurance, it's like I had three C-sections, and I can't even imagine without having coverage what it would cost and what those stays and surgeries cost. So,
Mhm.
just proving your point even more so, Miranda, earlier, where you're like, a day can cost you 10,000 or
Yeah.
more
Yep.
surgery.
Absolutely.
Um, so, all that to say, obviously we've talked about who Priority Health is, why, but like why choose Priority Health for your insurance?
Yeah. And me and Elmira always talk about how why we like Priority Health. But so we're not gonna do this that time. I have actually a statement from a member of ours. So I'm going to read some feedback from a member of
Is
ours.
it from me?
No,
Just kidding.
no, we've
Because
seen
usually
that
it's
one. It
me
was
praising like how I love Priority Health, but no, there we
yeah.
go. See, there
So
are
we
others
have
of us out there.
There are, yes, there are, yes. Members like Nate, for example, he had the opportunity to speak to a human, is what he said in Michigan. Again, as we discussed earlier, it's just nice to talk to somebody who's familiar with the area, the hospitals you're mentioning, those kinds of things. Um, and he said it was just to ask the important questions, get the right answers, not have to jump through a bunch of arbitrary hoops to get information. Um, his family is keeping Priority Health this year because, as his wife Amy stated, they do have children as well, and being pregnant, they found themselves at doctors' offices a lot. Her being pregnant and having, children. Having Priority Health just took one more thing off of their plates as they knew they had a great network, great coverage, and, especially preventative care, both for her while being pregnant and her children.
Yeah, and then for the second year in a row, we've been awarded the America's Best Customer Service by Newsweek. So when you contact Priority Health, you just don't talk to a Michigan, you don't, sorry, you don't just talk to Michigan-based teams. You talk to the best Michigan-based teams. We also offer virtual care options through Priority Health member portal. So you can access care, including mental health and urgent care, from the comfort of your own home.
Yeah.
So, it doesn't get much more local than that.
Yeah.
Yeah.
Those are convenient visits to do virtual
Yeah.
visits. I've done them with my son before, and you don't have to leave your home, which, I'm glad you mentioned the local aspect again. I think is what we've been talking about this whole time, because our community involvement is one of the major reasons that I am proud to be a part of Priority Health. I see Carrie a couple of times or maybe even 3 times a year, working with her in the community on the east side, even though I'm on the west side. So it's not just the programs we offer our members that help improve their quality of life, but the community outreach that makes health more accessible to all Michiganders.
Exactly. Miranda, I'm glad that you mentioned accessibility because we make access to care easy for our members, not just through our wide provider network, but also by not requiring members to have referrals to see a specialist other than U of M specialty care in Ann Arbor. I could keep going, Carrie, but I know we have limited time.
Yeah, I mean, just to piggyback on that, I love that was one of the major points for me is not having the referrals. This time savings that creates of not, when you need to go, you need to go. When you need to specialize to see someone, it to me that was a major deciding factor, and I have loved that feature ever since. So, um,
Yeah.
yeah, you can't overlook that. That's so important. But as you said, if to keep us in a timely manner, I know we're all busy and busy parents, busy moms, but let's skip to how do we enroll? How do we go? How does one go from listening to this, going online, searching? How do they finalize the package and the best package for them with Priority Health?
Yeah. So Priority Health, we make it easy and quick to enroll. It only takes about 15 minutes to sign up for peace of mind that can last months. Having your list of doctors that you see, prescriptions, that you take, hospitals that you prefer, is always great to have ready and on hand. So any agent here at Priority Health can, help you look up those doctors, make sure they're in network, your medications are on the formulary, and then a very easy process to help us determine which plan is going to work best for you and your family. You can call and speak to any of our experienced enrollment experts here, like Omira and myself. That we do have a number, again, pen and paper handy here, 833-630-1207. And they will help you find the best plan for you and walk you through the steps to sign up for it. You can also go directly to our website that Carrie had mentioned before, where she's using our Find a Doctor tool at mypriority.com. And you can also enroll there. If you have any questions, again, you can reach out to us. We're happy to answer those questions for you. 833-630-1207.
Yeah. Just to be able to actually, going back to Nate, if I remember his name correctly,
Yeah.
that just to be able to talk to you guys directly and actually have a human. I know people throw out numbers and websites, it's like, and chats, but this is so important. And to navigate it alone, personally, it's so daunting. It's so over. I don't understand it. And I'm grateful for you guys because I was in the wrong, completely wrong type
Yeah.
of coverage for my family without even knowing it.
Yeah.
Obviously you think you're doing the right thing by your family and you're navigating this, but I can't state it enough, like how amazing you and your team has been in helping me navigate it and actually get the coverage my family needs. So,
Yeah, I
uh,
think that's the words that we hear often when we're answering the phones is,
Hmm.
oh, you are in Michigan. Okay, great. So you'll know
Yeah.
Beaumont. Yes. Yep.
yeah,
You
Hmm.
can definitely help us. So it's just it's comforting when you know someone is local and
Yeah.
are familiar with what you're speaking of.
It definitely
especially
makes
since
a difference.
everyone's changing names now. It's like,
Yeah.
well, okay, I'm gonna forever
Yeah.
call it Beaumont,
Uh-huh.
and you guys will hopefully know what I'm talking about. But yeah, is there anything else you guys want to share with us as we close this out?
Only that the opportunities like this to talk to Michigan families about the importance of health are amazing. And we're both so grateful for the chance. We're proud to work for a company that's working to improve health for all Michiganders and want to thank you for helping be a part of that. Like I'm excited for the next events coming in
Yeah.
2026. They're always my favorites. So,
Oh, thanks, guys. We appreciate it, and as we've alluded, Priority Health is a major sponsor, is the presenting sponsor of our stroller rolls. And last year alone, I mean, we gave out thousands of free diapers, packs of diapers and wipes to those
mhm.
that came to our events. And you just have been integral partners in not only educating people about what you do for them and their families, but then also talking the talk, walking the walk, being there and handing out those diapers and goodies. We still have all of our goodie Priority Health, that frisbee that I swear
Yeah.
that lives in my basement.
Yeah.
So we're so
We got to give
grateful.
away a stroller last year and it was so fun. Me and Miranda were kind of walking around looking for, maybe a mom that may needed one and we saw this
Ooh,
mom with the most tiniest little wagon little stroller and she was just so happy to be able to have something to
I
carry
love
more of
it.
her stuff around for her and her kids. They could even fit in there. So,
Yeah.
Yeah.
Yeah. It was cool.
Love it. Well,
mhm.
thank you guys so much. Thanks for your time. Thanks for your expertise. As I said, I'm truly I'm staying on to figure out what my family's doing this year for 2026, making sure we have the best coverage. So thank you both for joining us and lending your expertise. If, as they've said, we'll give it one more time. How about the number and the website one more time?
Yeah, 833-630-1207. Or you can also go to mypriority.com.
And that's, again, you have till January 15th. I'm looking at the calendar that is quickly coming up. That's next
Hmm.
Thursday,
Okay.
January 15th. So get on it to get your family covered. Thank you again, ladies.